Hello students, welcome back to our channel. This is Panchakshari. In this video I am going to explain about the next part of the pre-operative assessment. Pre-operative assessment in previous video we are going to discuss about the all history and investigations. And in this video I am going to discuss about the instructions. In this video I am going to explaining about the instructions related to the modification in the pre-existing medical therapy related to existing medical diseases. Already patient has some existing diseases, medical conditions. They are taking some medicines. You have to be some medicines cut off and some medicines you should be take at the time of surgery, at the day of surgery. All the drugs should be stopped before only. Which drugs you should stop and how it is. Okay, first one, oral anti-diabetic. Oral anti-diabetic drugs like insulin and oral means metformin. All these are come under the oral anti-diabetic drugs. Oral anti-diabetic drugs should be stopped 24 to 40 hours before the surgery. Before the surgery, 24 to 48 hours means 1 day or 2 days before only they have to stop oral anti-diabetic drugs. And insulin is adjusted by a dose. Insulin should not be stopped. It's adjust the dose based on the patient random blood sugar and HbA1c. All these are considered, then only adjust the insulin dose. And next one is oral anticoagulants. Oral anticoagulants means warfarin and dabigatran. Warfarin should be stopped 4 days before the surgery. Warfarin should be stopped before 4 days. 4 days before only we have to be stopped the warfarin. And dabigatran is 3 days. Like these two drugs are anticoagulants. It should be stopped before only 4 days before only you have to be stopped. Next one is heparin. Heparin is also anticoagulant. It should be stopped 12 to 24 hours. LMWH, low molecular weight heparin, should be stopped before surgery, 12 to 24 hours before only. It's guidelines for anticoagulants. Like anti-anginal drugs should be continued. Anti-anginal drugs are continued at the day of the surgery. And antiplatelet drugs, aspirin should be continued. And clopidogrel stopped 5 days prior to surgery. What that one? Antiplatelet drugs like aspirin is okay to continue till the day of the surgery, and clopidogrel should be stopped 5 days prior to surgery. Clopidogrel, it is a antiplatelet drug. It should be stopped before only the 5 days prior to surgery. Why? If it is emergency, in this condition, if it is emergency, patient on antiplatelet drug like clopidogrel or else aspirin, in case emergency, there is no time to stop antiplatelet drugs. That time you don't have a time to stop antiplatelet drug. That time patient can be taken for the surgery after the platelet transfusion. Once the platelet transfusion is done, then only taking to the emergency surgery. If can't able to cut off the antiplatelet drug in this case only. Okay. Next is antihypertensive drugs. Antihypertensive drugs means BP tablets. All antihypertensive drugs can be continued if BP is controlled. If BP is controlled with the medication, it should be a control. It should be a continue. It is okay to continue. If it is not controlled, you have to be controlled first. Then only take a surgery. Okay. Then accept angiotensin II antagonist and ACE inhibitor. Accept antihypertensive. I will going to discuss antihypertensive drugs in upcoming videos. Here they are telling about the angiotensin 2 antagonist and ACE inhibitors should not be continued at the day of surgery. Only morning dose withheld at the time of surgery. It's a angiotensin 2 and antagonist and ACE inhibitor. These two types of drugs, they are only morning dose withheld. Okay. Antihypertensive, then antidepressant all to be continued at the day of the surgery till day of the surgery, and MOA inhibitors need to be stopped 3 weeks before. 3 weeks before only you have to be stopped antidepressant drug, particularly MAOA inhibitors. These are group of drugs that should be stopped before 3 weeks only. Okay, next one is smoking. Smoking is you should be stopped before 8 weeks. 8 weeks before surgery you should be stop smoking. And herbal medicine 1 week prior to surgery. 1 week prior to surgery you have to be stopped herbal medicines. If you are the patient they taking some herbal medicines, it should be prior to surgery, 1 week prior to surgery, stop. Diuretics discontinued on the day of the surgery. Diuretics should be stopped or discontinued on the day of surgery. And anti-tubercular drugs are continued as the day of surgery. All these are related to the modification in the pre-existing medical therapy. Okay, or the patient has a medical condition they are treating and they are taking medication on the some conditions. That time you have to be some of the drugs should be stopped and some should be continued at the day of the surgery. All these concepts is related to pre-existing medical therapy. And next is pre-medication. Pre-medication I will discuss in the this video next chapter. Pre-operative instructions. Pre-operative instructions in previous I will discuss about the what are the medication and coexisting disease, which are the drugs you should be stopped and you should be go on medicate with the at the day after surgery. In this session, we discuss about the pre-operative instruction as well as pre-medication. Okay, pre-operative instructions. Pre-operative instructions means before the surgery, you should give us some instructions as well as before only you will see about the histories and all. Like some instructions should be given at the before the surgery, before shifting to the pre-operative. Okay. Fasting instructions. First one is fasting instructions. It is very important. Fasting instructions, solid food 8 hours. It's a very mandatory thing. Solid food should be instructed to 8 hours. 8 hours nil by orally, it is very important. Solid food 8 hours. Clear fluids 2 hours. Clear fluid means water. 2 hours is 2 hours minimum. They have not to take any clear fluids. Okay, if they are taking juice or anything, it should be considered as solid food. Okay, it is a adult, and for neonates and infants, it's separate by childs and infants and neonates. Breast milk, it is a 4 hours. For neonate babies, breast milk, it should be a 4 hours fasting hours. 4 hours before only baby have to feed. Okay. Formula milk and solid, like some milks, formula milks are there, should be instructions 6 hours. 4 hours for breast milk and formula milks and solids 6 hours for neonates and infants. Artificial dentures and limbs and contact lens should be taken off. artificial dentures, limbs and contact lens should be taken off before the surgery. Okay, then jewelers and nail polish to be removed. Jewelers and nail polish should be removed before the surgery, and before coming to the pre-operative ward you should be taken off all these things. And good oral hygiene should be done before the at the day of surgery. And informed consent should be taken. Informed consent should be taken before operating in pre-operatively, and give the instructions to the and guide to the patient about the procedure and all. Okay, next is pre-medication. Pre-medication you will see in the next. Pre-medication is very important role in the pre-operative instruction. Pre-medication helps to relieve some anxieties and all. Okay, pre-medication we will discuss in this, and all these are pre-operative instructions along with the medication and related coexisting disease. That is also important. Along with this, that these all things and points are very important to pre-operative instruction. Next, coming to the pre-medication. Pre-medication itself it is told pre-medication, like a pre-operative ward only you have to be use some medications that are called pre-medication drugs. Main goals of pre-medication to relieve anxiety, as well as pre-assessment goals. Already you know about the pre-operative goals. Pre-operative assessment goals are same as a pre-medication, like some to relieve anxiety, to relief from the anxiety. Some patients are very anxiety to the procedure and the operations and all. Okay, they are thinking and they are not sleep at whole night before the surgery. That will be happen in the patient. It should be reduced by the pre-medication. And to produce the hemodynamic stability, if you give a pre-medication. And next one is pre-medication to reduce the sedation and reduce the metabolic rate. It's induce the sedation, it under good sleep, and reduces the metabolic rate. To provide analgesia and amnesia. Okay, it's a provide analgesia. Analgesia means pain relief. Analgesia and amnesia, both it's provided by pre-medication. And to decrease the chance of aspiration, decreases the chance of aspiration in intraoperatively. Okay, and to control oral and respiratory secretions. If it is GA case, it's control the oral and respiratory secretions intraoperatively. And to prevent post-operative nausea and vomiting, it's also prevent post-operative nausea and vomiting. So intraoperative nausea and vomiting also controlled by some antiemetics. And to control infections, their antibiotic prophylaxis should be done in the prolonged surgery as well as post-operative and pre-operative also. And to relieve anxiety relief drugs are there. They are giving that for relieve anxiety. It is a benzodiazepines used in the nowadays. Midazolam is used for the relieve anxiety. And next one, induce sedation and reduce the metabolic rate. It is okay, and provide analgesia and amnesia. It is used for that. Used opioids in the analgesia and amnesia pre-operatively. And decreases chance of aspiration. Aspiration chances are decreases by some anti aspiration preventing drugs are there, like metoclopramide. All these are decreases the risk of aspiration, and ranitidine all are used in the aspiration risk if it is more. And control oral and respiratory secretions, you will use anticholinergic drugs, glycopyrrolate used in the reduces the secretions. And post-operative nausea and vomiting, you are using the antiemetics like Perinorm and ondansetron. To control infections, we are using antibiotic prophylaxis as per the patient condition. All these are related to pre-medication and pre-operative instructions. Till this, it is a pre-operative assessment. One by one, I explain everything. Pre-operative assessment part 1 video I have already uploaded in my channel, and it is a part 2 continued. All these are concepts come under the pre-operative assessment, and in next video I am going to explain about the next concept like intraoperative and difficulty management, and all these are general anesthesia, spinal anesthesia, epidural anesthesia. All these concepts are discussed in the upcoming videos. Thank you for watching, and thank you so much.